Dr. Christy Bailey, and this is the first official edition of the Bailey blog. Thanks for everybody for joining. I hope you're having a great week. I was thinking about what we might start with. There's a myriad of topics we could go for, different lenses and surgical techniques and medications and all of that. And I do want to spend time doing those things, getting into the more nitty-gritty clinical stuff. But I thought it might be nice to start with just how I approach a patient. What do I actually say? Everybody's got their own style and their own approach and their way of connecting with the patient. So I found what works for me, so I thought I might share that with you. So a patient being referred in for a cataract evaluation, of course, when they arrive, they'll have their testing done, their A-scan, their topography, their OCT of their macula, their meibography. They'll meet with members of my care team. We'll get a sense of what's going on with their vision, what their concerns are, etc. And I'll review all of that before I meet with the patient. And I'll also review your notes. So just a shout out to the notes. Those are extremely helpful. So your patient. This is the first time that I'm meeting them. So I really do appreciate it when you share with me things that have worked well, things about what hasn't worked well, what their personalities are like, what you feel like is most important to them. So thank you always for sharing that information with me. So once I've reviewed all of that, I will then of course meet with the patient. And even though they've had a lot of testing done, they've answered a lot of questions already, I always go back to my essential one, which is what bothers you the most about your vision? And I listen carefully to what they say, because that tells me a lot. It tells me where I should meet this patient, because I always want to meet them where they are. If patient's first complaint is, my eyes sting and burn and they water all the time, and I'm yammering on about a PanOptix lens, I'm not meeting that patient where they are. So I really try and listen to what they tell me and the order in which they tell me. I also ask them a little bit about what their life is like, what they do, what their hobbies are, etc. And then I go into my clinical exam. So I obviously do a thorough exam front to back. I've already have notes from you and also my care team, but I still repeat it myself for sure, just to make sure, everybody picks up their own little nuances. And then I sit back and explain all of that to the patient. From the front part of their eye to the back part of their eye, every single thing I see, and what I think that pathology might be, how it might be affecting their vision now and in the future. Because I feel like the better educated they are, the more engagement we will have with them on their eye care now and down the line. Once we've gone through that process, then I turn my attention back to the cataract and explain, essentially how a lens functions. I love models, so I'm always using, handheld models and visual aids. And so I'll explain to them, how a lens functions, what happens to it over time, how presbyopia develops, how the lens then gets cloudy. And it's fun when you can see, the acknowledgement where they're like, oh yeah, I remember when I couldn't see up close anymore. And they you can see the click happen, which is really great. And then we'll talk about, whether their lens is ready for cataract surgery. And I'll explain how the cataract surgery is performed, the steps of the procedure, what to expect that day. All of that goes in. I'll then explain the healing process, what to expect from the post-operative appointments, how many there will be, etc. And then of course, I discuss very thoroughly all the risks and benefits from the cataract surgery. I want to make sure they have a full understanding. They've seen some videos about all of this prior to my entering the room, but I think my going over it, with them personally really makes a big difference. I want to make sure they understand everything. At this point, I will, then say, and once you're all healed from the cataract surgery, then you can have your glasses updated and they'll actually really work like they're supposed to. And that I find is a really natural segue into different lens options, because as you know, we have a veritable cornucopia now, and that's a wonderful thing. So I try and explain that, getting glasses after cataract surgery, your standard lenses are extremely high quality. They give great vision. You'll just need glasses to do your fine tuning. And for a lot of patients, that's wonderful. They love their glasses. They would far rather be in their glasses, and that's great. I want them to make sure that they don't feel like they're getting a less quality lens if they don't go for a vision correction option. But then I'll also describe that, hey, for people who are not, fortunate enough, because some people are, to have a standard surgery and they still can only get to only wear cheaters, there are other options if we really want to work towards getting some freedom from glasses. And then I will go into vision correction level 1, correcting for both a far, or rather a far or a near, not getting both. Vision correction level 2, and I will discuss the difference between a multifocal, trifocal, and an extended depth of focus lens and the pros and cons between the two. And then I'll also talk about vision correction level 3, where we're talking about a light adjustable lens and the advantages of that. So at this point, you can sometimes be seeing a complete deer in the headlights look, obviously, because you're taking a drink out of a fire hydrant going full blast. So I then want to make sure I reassure them that they do not have to make an on-the-spot decision. This is a lot to consider. And I want them to have time to let it marinate, to read about it, to do some research on their own if they want to ask more questions, all of that. And I will, based on what they've described for me in terms of what they would like to have and what I see anatomically they're eligible for and what would work best for them, I'll let them know, based on what you've told me and based on what I'm seeing, I think these are the options that would work best for you, and go home and think about it. We've got some time, and let's make some decisions based on what you decide later on once you really fully had a chance to digest what would be best for you. Sometimes they know, obviously, right away. They already know, and they're giving me that information, and boom, we go right into the planning. But again, I want them to have time to let it marinate and make sure that all of their questions get answered. As we all know, a better educated patient and a fully informed patient, we always get better results because they understand what they're getting, and therefore they're going to be more engaged. So, and then at that point, we head off to speak with our surgery scheduler. So that's generally my approach. I'll often schedule follow-ups for those patients who would like to have more discussion, or offer to do that either on the phone or virtually, but just really want to take my time to get to know the person, really connect with them, find out what is important to them so that I can provide that and make sure that they understand all their options. So I know that's a lot, but that's my gist. I'm also, I have great, visual aids that I use. I find those to be really helpful. Happy to share those with anybody who would like to see them. I can yammer on, all day long with the patient talking about different, visual issues, but a picture's worth 1,000 words, much like I'm yammering on now. Well, with that, again, thanks so much for your time. Any additional topics or questions that you would like to hear about, I'm always delighted to share. We'll start here, and the next couple of ones, we'll get into more specifics about different lenses and stuff, and probably be a little bit shorter. But that's my approach. Hope that helps you. Have a wonderful day. Look forward to chatting with you again soon.